Now, a new treatment is being put to the test, and it involves stem cells from umbilical cords. Joining me now is Dr. Camilo Ricordi, director of the Diabetes Research Institute and Cell Transplant Center at the University of Miami Miller School of Medicine. The medical school just began using stem cell therapy on COVID-19 patients this week. Doctor, thank you so much for being here. Can you just walk through, this is an experimental treatment, perhaps not familiar to a lot of people. What is it that you're trying in these COVID patients? And have you gotten anything promising so far?
Yes, practically we started using and working with umbilical cord-derived stem cells, mesenchymal stem cell, many years ago. I direct the Diabetes Research Institute at the University of Miami, and the first trial we did in collaboration with China have been to use this to stop the aggressive immune attack that occurs in diabetes, in type 1 diabetes. And these cells have been used in many autoimmune disease conditions. When COVID exploded, we immediately communicate with our collaborators internationally and say, have you tried to use these cells? And they have been using them with some remarkable results initially, but these are uncontrolled trials. So if you wish, it's anecdotal information. So we thought it's critically important to do a randomized prospective trial, a real scientific validation trial, like you've been discussing before for hydroxychloroquine, is important in this phase. People can try, but before someone can make any claim, we need to have a very solid, scientifically driven, randomized prospective trial. And this is what the Food and Drug Administration just allow us to go forward at the University of Miami, and we just started this week this trial in collaboration with many institutions in the United States, Europe, and Asia. So it's an international team of investigators. We have several centers from Stanford to Hackensack Medical Center, Georgetown, and many institutions that are willing to participate and start doing similar trials, and we are very eager to find out what the results will be, because this is not a trial that will require years. It's something that we'll know in months if there is a success or not.
Yeah, I was just going to ask you about that, because I was reading a little bit about your research before we came on the air, and it seems as though that anecdata that you were talking about, that information that we have been getting from China, from Italy, from other places, seemed to suggest that this therapy might be something that would work within a matter of days for these patients. I mean, what is the timetable in your being able to determine whether or not this works? I mean, is this a treatment that could be ready potentially by summer, or where do you think it stands?
I think it will be a question of a month, 2 months to 3 months. We should have clear indication, because these cells is like if you inject endovenously, these cells go to home in the lung naturally. 95% of them are trapped in the lung. And it's like if you inject an army that is like smartphone technology to target the inflammation and the side effects that are in the lung due to the COVID severe cases. And so these cells have both antimicrobial activity, they counteract the cytokine storm, they counteract inflammation, and they promote tissue repair and regeneration. So it's like are used in many other diseases. We have trials ongoing in Alzheimer's, in type 1 diabetes, but it seems like an ideal cell source to target this kind of injury. And if you think that one umbilical cord could treat over 10,000 to 15,000 doses, and it's taken from a baby after delivery, instead of throwing away the umbilical cord with the placenta, you can retrieve it and prepare like an army of doses to treat the most severe cases, should this prove successful.
All right, Dr. Camilo Ricordi, we will be watching your progress very closely as you guys continue to try and find treatments for this terrible disease. Thank you so much for your time tonight.